And then okay, we are live. Okay. Welcome, everyone. We're so happy that you're here joining us. We are here today with Jeanne Struve, who is a registered dietitian with the Lee Health ALS Clinic in Fort Myers. And Jeanne is joining us today to talk about what's wrong with a little weight loss. Jeanne?
Thank you, Patty. I appreciate that. As she said, I am a registered dietitian. I have been for over 25 years, and I do work with the ALS Clinic, which has a very special place in my heart. So the interesting thing is, the rest of the time, I work in an outpatient setting in a doctor's office, and doctors are always sending people to me because they need to lose weight. People walk in, they say, oh, I need to lose some weight. I need to lose some weight. I've got diabetes. I need to lose weight. And it's just constant. And if you look at, any magazine, any ad on TV, you're going to see that the weight loss industry is like $1 billion industry. There is just an overload on it. And then what happens is you get diagnosed with ALS, and just like every other part of your life, that comes to a screeching halt. No longer should anybody be telling you to lose weight. So it is so important when you have ALS not to lose weight. I don't care what your starting weight is, unless you're hugely overweight, which I have yet to see. It is so important to hold on to that weight and keep carrying it. There is a clear link between weight and survival when it comes to ALS. What you're looking for literally is a cushion. Most people call it a spare tire. I call it a cushion. So once you have that diagnosis, the thing you want to do is either maintain your weight, or if you need to, gain weight. The studies have shown that people who are slightly overweight at diagnosis and people who maintain their weight throughout the course of the disease will live longer than those who start out thinner and those who lose weight during the progression. And it can be challenging, and I know that. But what works the best is to track it. If you are able to, get on a scale at least once a week and watch that weight. If you aren't able to get on a scale, maybe if you're going to infusion somewhere, if you're in a wheelchair and they can weigh you, that's great. I know at our clinic, that's one of our things that we aren't able to do, is if somebody is in a wheelchair, we are not able to weigh them. Sometimes physical therapy is able to help them get up and get on a scale so we can get a weight. But it is so important to track that weight. Even if you have a caregiver who maybe can periodically kind of hold you to see. I know when you're living with somebody day in and day out, or when you're looking at yourself in the mirror, you don't always catch that you've lost some weight, because I'll have people come back after several months and they are noticeably thinner. They have noticeably lost weight. So I'm constantly trying to talk to people and say, please, 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 don't lose weight. So why is weight loss an issue with ALS? Well, first of all, ALS is what we call a hypermetabolic disease, which means just because you have this disease, you're burning about 15% more calories every day than you did before the diagnosis. So even though you may say, well, I'm not doing anything, I'm just sitting around all day, you are burning more calories. Another reason is fatigue, because most people don't realize that chewing, swallowing, digestion pull energy. And sometimes when we're eating, we just start to feel full, but it's not that our tummies are full, it's that we've just gotten tired and we're just too tired to keep eating. Constipation is another issue with ALS. I know we have people who can end up going 3, 4, 5 or more days without having a bowel movement. And what happens is you keep going day after day without a bowel movement is it affects your appetite. You feel so backed up, you don't feel like eating. So making sure that you have things in place, stool softeners, fiber works the best. I much prefer that you handle constipation from your diet. So making sure that you're well hydrated, because if you're not well hydrated, you will get constipated, and getting lots of fiber in the diet will help. There's also the difficulty with meal prep. Perhaps you were the person that used to prepare all the meals, and now the person who's in charge isn't doing such a great job. Or maybe you're just having a hard time with it, and so you end up just doing quick things that aren't very satisfying, and or maybe you're eating or drinking the same things over and over and you get bored, so you just lose that pleasure in eating. And of course, if there's difficulty swallowing, that is going to play a role. If you're scared to eat, if you're scared you're going to choke, if you're scared that something's going to happen, or if you just are having a hard time and you're having to chew and chew and chew. And remember, I told you earlier, chewing pulls energy. And so maybe you've just pulled all your energy because you're having difficulty swallowing. So addressing these other issues does help you prevent weight loss. And the thing is that malnutrition is a big deal with ALS. They think that about 20% of all ALS patients are malnourished. And it doesn't always have to do with the weight, but weight can definitely play a role in it. And the thing is, with malnutrition, you are going to get more muscle loss. If your body doesn't have fat stores to use for energy and you're losing weight, it's going to be taking muscle from you. And the thing is, ALS steals muscle. The last thing you want to do is voluntarily give some muscle away. So you want to prevent that muscle loss. The other thing malnutrition does is it impairs respiratory function. And we know how important breathing is in ALS. And of course, it can accelerate mortality. And not just cutting back on the length of your years, but the quality. And that's what we're always after, is to give you the best quality life. And when you're not getting enough nutrition and you're losing weight, you're affecting your quality of life. Because the thing is even if, let's say, fatigue is leading to weight loss, well, that weight loss is going to accelerate the fatigue because you don't have the energy you need. So now you're on this vicious little cycle. So it's so important to take time to figure out how to get that nutrition in. You know, if you have a decreased appetite, some things that we recommend is that you eat more often. I know I talk to patients who have always eaten just 3 meals a day. Well, that doesn't work so well now. So maybe eating something every 2 hours is going to help keep your weight up. And of course, choosing higher calorie foods, and that also leads into the next one. You want them to be nutritious foods. You don't want to just sit there and get a package of Oreos and start eating them. I mean, it's okay to have a couple, but you really don't want to sit there and get all your calories from junk. You want good quality, higher quality foods. Those little Haas avocados, you know, those little ones that you see for sale around here so much, have 240 calories. If you love that, mash it up, have avocado toast, put a little salsa in it, and eat it on all kinds of things. Put some black beans on it, put it in a tortilla, very soft, easy to do. Nuts, seeds, wonderful, nutritious, high calorie foods. If nuts are difficult for you to chew, you could try roasting them at a very low temperature to get them crispier, and they're a little easier to eat then than when they're raw. Or go with any of the nut butters. You can get peanut butter, almond butter, cashew butter, hazelnut butter. If there's a nut, there's a nut butter to go along with it. Consider drinking your calories. The thing about digestion is chewing pulls more than just swallowing. So if you are drinking calories, it doesn't pull as much energy for you. So that's a great way to get calories without feeling fatigue. Now, supplements, and you see I say no soda. Really stay away from that poison. And it doesn't have to be Ensure booze. Those are convenient. They're set up. They're wonderful. But you can make your own smoothies. You can, you know, put together things that you can drink. just be careful when you're looking at a supplement that you don't just focus on protein. I know something like muscle milk has about 160 calories and 30 grams of protein. And in this country, we're very protein minded. And even with ALS, we know we need protein. But the problem is if you just focus on protein and you're not focusing on calories, your body's going to use that protein for just energy. So you need enough energy so that your body can utilize the protein effectively. So something that has 350 calories and 20 grams of protein is going to be far, far better for you. So look at calories. The other thing that does help if you have a decreased appetite is not to drink many fluids with your meals. Try to drink your water or any other fluids between meals, because what happens is your stomach can only hold so much. So when you're drinking a lot of water or fluid with your meal, you're going to feel fuller faster. And another tip is to eat larger amounts earlier in the day. If you are a person who wakes up and has more energy earlier in the day, have a big breakfast, have a larger lunch. And if your energy is flagging by the end of the day, then drink your calories or go with softer foods, at that point. But utilize your strengths and know yourself. One time I did have a patient and they had much more energy later in the day. So they had a smaller breakfast and were able to have a larger dinner. Know yourself and know your energy levels, because you only have so much energy in a day and you don't want to utilize all your energy eating. And the other one is allow time to eat. I see this a lot on clinic days. People will not eat breakfast because they have to get to clinic. Please, please, please think of nutrition. You can't make it to clinic if you don't put gas in your car. You don't really want to try to make it to clinic without gas fuel in your body. So make sure you have time to eat, okay? So let's look a little bit more about nutrition. So first of all, it is important to nourish your cells. Well-nourished cells are going to do better. We want to look at things like fruits and vegetables, whole grains, beans, lean meats, nuts, seeds. These are wonderful foods. Load up on healthy foods. Limit your sweets. I didn't say you had to eliminate them, but limit them. I know sometimes I've had patients come in and they're eating candy like they're going out of style. So, think you've got to fuel the body. Again, no sodas. Fat stores means, again, having that cushion so that you've got something. If you hit a bump in the road and you do lose a few pounds, you've got some fat stores to pull from. Again, malnutrition is too common and you don't want to be someone who's suffering from that. And what we have found is that nutrition is an independent predictor for survival. It says, although human studies on nutrition in ALS have yet to determine the optimal diet, when they've done mouse studies, and granted they're mouse studies, they suggest that a diet high in fat, but you want to get some really good fat in there too, and high in nutrient-dense foods like fruits and vegetables are best. High protein diets and protein supplements have generally been found to be unhelpful in slowing ALS disease progression. So you want healthy foods, whole foods, lean cuts of meat, but because you don't want your fat just coming from animal fats. Get your fat from plant foods. And then what happens if you just can't get the nutrition that you need? That says because you need it, right? What happens when you don't get that nutrition, when you're not getting enough energy? I strongly recommend that you consider getting a feeding tube, but that's a talk for another day. So I wanted to check to see if we have any questions. I wanted to make sure we left a few minutes.
Thank you, Jeanne, for that. I'm just looking at the chat feature here and don't see any questions yet. We'll see if any pop up. I heard you talking about the scale and tracking weight. And, what are some other ways, if you can't get on a scale or if you're discouraged by the scale, what are some other ways to monitor that? You kind of mentioned, when you're living with someone day to day, it's maybe how your clothes fit, or is there another way to kind of monitor that?
You can, I mean, out in, normal life, you can do things like measuring arm circumference and stuff, but with the muscle wasting, sometimes you've lost muscle. You haven't necessarily lost weight. Maybe like once a month, taking a whole body picture and just kind of looking and comparing. I think clothes do help and things will shift. If you're sitting in a wheelchair, you're going to find that things shift, but kind of looking at the face and shoulder and, your clavicle area, because these are some areas like here in the forehead and in the clavicle area are places that we actually look for malnutrition. So just kind of making sure that you still have fullness here, fullness under your eyes, and, that your collarbone isn't like very predominant.
That's great. That's very helpful. And then I do have a question here. It says, what do you recommend for patients who would rather make their own tube feeds from home versus using a commercial supplement?
Yeah, first of all, there are some whole foods tube feedings now that you can get where if you look at it, it's chickpeas, it's real food. So you can look those up if you rather, because you're not interested in something like a Jevity. There are plant-based ones like Kate Farms that are excellent. So do look out there, but if you're interested in making your own, I'm sure there's information on the internet. The biggest problem I have is the volume, because you have to get things small enough and have enough fluid that things will flow through the tube and not get stuck. And sometimes what happens is you have to put so much fluid in there that the volume is so high that you can't get enough calories in. So it's not impossible, but it can be very challenging. And again, as great as nutrition is, I don't want your whole life to revolve around your meals, because there's so much life you still want to live. So look at some of these other products that are out there before you start to look at, doing it yourself, because it's not impossible, but it is challenging. Okay.
Okay, that's good. And that kind of leads into another question, is how to add calories when you're eating a diet. Do you increase the Kate Farms formula or try another liquid nutrition?
Wait, say that again. It's what?
It says, how do you add extra calories when only eating with a feeding tube? Do you?
Okay.
Yeah.
There's different ways. Sometimes, depending on what you're on, you can go to a higher calorie formula. Like some people go home on Jevity 1.2 and just switching to Jevity 1.5, they get about 100 calories more per container. Sometimes you may need to find a way to get another container in a day. A lot of times we recommend gravity bags, because you can do like 1 1/4 and take it in slower. Sometimes you're limited because you're just doing the syringe too fast. Was that our ding? Okay, we still have time.
Yep. So we have about 1 minute and 15 seconds left. So if we don't get to everyone's questions, please stop by the booth. There is a booth in the Learning Lab, and you can follow up with, but there are some great questions here. It says, do you ever suggest early PEG placement to supplement a PO diet for people that are already at high risk?
Yes. I would rather have it and not use it very much than wait till you've needed it and then start using it. Being proactive as possible is always better. There is some problems with insurance paying for formula, but I know our clinic keeps a closet where we have donated formula. I would hope the other clinics do that. So there is ways to get that. But I would definitely recommend having that feeding tube earlier rather than, later.
And then really fast, if we can squeeze one more in, do ALS patients lose their hunger trigger?
I don't know if they really lose their hunger or if it's a result of fatigue. Because fatigue does affect your hunger. That's a little harder for me to answer.
So thank you so much, Jeanne. We really appreciate you joining us today.
And I'll be at the Learning Lab this afternoon.
Thank you.
Bye-bye. Thank you.